Narendra Modi. Being received by the Union Minister for Health and Family Welfare, Shri J.P. Nadda, and other dignitaries. A major highlight of the summit is the ministerial conclave, where Minister of Health from 24 participating nations will reflect on initiatives that their countries are taking. Here he is being introduced to the various delegates, both from India and from other countries, delegates of UNICEF, USAID, the Tata Trusts, and the Bill and Melinda Gates Trust. The meet, of course, will evolve a set of tangible outcomes to create avenues for strong partnerships among countries in maternal and child health. A small photo op. This is a policy-making summit where all countries will brainstorm in order to come up with strategies that are attainable and sustainable. The Prime Minister being introduced to some of the delegates from the various countries. The participating countries are Afghanistan, Bangladesh, the Democratic Republic of the Congo, Haiti, Indonesia, Liberia, Madagascar, Malawi, Mali, Mozambique, Myanmar, Nepal, Nigeria, Senegal, South Sudan, Tanzania, Zambia, and Ethiopia and the US. One by one, the Prime Minister is being introduced to the delegates. These are ministers of health and some of the senior officials from these 24 nations. Each country brings with itself their strategies and success stories, which will be part of this convergence, the sharing of the various strategies, the success stories. And we see the delegate from Nepal. The idea really is to create a fertile ground for learning and growing through a dynamic and enthralling experience. And a part of this experience is the marketplace, where the Prime Minister is now being introduced to various delegates from the different countries. The marketplace is divided in 5 thematic zones corresponding to systems, partnerships, innovations, convergence, and evidence. India has an outstanding story when it comes to checking maternal and child mortality, as the rate of decline in this regard has been better than the global average. The decline rate of infant and mother deaths has been high due to effective health practices, vaccines, and the deaths have fallen by nearly 50%. In India, there are also plans to bring traditional medical practices into play. Ayush, that is Ayurveda, Yoga, Naturopathy, Unani, Siddha, and homeopathy doctors are also being roped in rural areas to facilitate access to healthcare. A photo up here with the various delegates. The backdrop, Call to Action Summit, which is being held for the first time outside of the United States of America. The first summit was held in 2012, and huge progress has been made in these few years in the field of ending preventable deaths of mothers and children. The Prime Minister being conducted around what is called the marketplace. He looks at the various stalls, various success stories, various methodologies which are being adapted by different countries, and the success stories that the different countries have also achieved through interaction with each other. The marketplace has been divided into two major outlets. The Prime Minister looking very carefully at the theme of partnerships, which is a government and corporate coming together with a common purpose, where best practices are brought together for this enormous task of ensuring that mortality rates are brought down where women and children are concerned, and this is the feather in India's cap, India's triumph over polio. It was a beautifully done campaign, and the tagline, "Do Boond Zindagi," is something we are all familiar with. It took us several years, and finally in 2013, India was finally polio-free. These are some of the methodologies of dissemination. We can see a three-wheeler with a speaker on top to the right of the screen. Eradicating infant mortality and improving maternal health are also a part of the Millennium Development Goals, or the MDGs of the United Nations. The summit will adopt policies to move ahead in the world scenario. The Prime Minister looking at some of the pamphlets and booklets that have been printed for the occasion. A brief look at some of the reading material which is available here, and now at some of the innovations that are being adopted in our country to ensure better health, better sanitation facilities, availability of medicines, as is being demonstrated here to the Prime Minister.
आपको ये पूरा इसमें प्रोसेस दिखा देता है। अब जैसे अगर आपको ये पल्स ऑक्स करना तो अगर आप अपनी फिंगर डालेंगे इसमें तो आपका ये रिजल्ट इमीडिएटली दिखा देगा। अगर 90 से कम है तो सर जो साथ का FRU है, फर्स्ट रेफरल यूनिट है, प्राइमरी हेल्थ सेंटर है, वहाँ पे ये इन्फॉर्मेशन इमीडिएटली चली जाएगी कि इस माँ को, इस बच्चे को इमीडिएट हेल्प की ज़रूरत है। 108 सर्विस अपने आप कॉल हो जाएगी और सारा का सारा जो सिस्टम है सर इसमें हो जाएगा। बैग सर ये पूरा का पूरा सोलर पैनल का बना हुआ है। सो आप जैसे इसको लेके जा रहे हैं, अगर लेह लद्दाख में लेके जा रहे हैं तो ये साथ साथ चार्ज भी होता रहता है। और पूरा जो सिस्टम है सर ये सारा हमने NHM के साथ बनाया है। और यहाँ पर इसमें देखिए सर सारी की सारी जो किट्स है, आपके सारे HIV, सिफिलिस, सारे जो आपके टेस्ट हैं वो यहीं पे आ जाते हैं। और ANM इसको कहीं पे भी यूज़ कर सकती है। जो आपका विलेज हेल्थ एंड न्यूट्रिशन जो है, जो आपका पंचायत है, वहाँ पर ही सारे टेस्ट हो जाते हैं। और सर मज़े की बात यह है, जहाँ पे मदर आती है तो मदर इन लॉ भी आ जाती है। सास भी साथ में टेस्ट करा लेती है, ससुर भी, सो पूरी फैमिली के सारे टेस्ट कहीं पे। सर अगर आप दिल्ली में माँ का टेस्ट करेंगे तो सुबह होगा, शाम को आपको पूरी रिपोर्ट मिलेगी। यहाँ पे सर रूरल एरियाज़ के अंदर जहाँ जम्मू कश्मीर में चला रहे हैं, 45 मिनट में सारे टेस्ट और सारा रेफरल हो जाता है।
Amazing how Make in India and Digital India are contributing to health in India, especially for the mother and child, because that is the basic unit for the development of any country, any society, and any economy. The Prime Minister is now leaving the marketplace, which will be open to visitors through the summit. The various delegates will come here and see what is happening. And this is a view of the plenary hall where the Prime Minister will inaugurate the Call to Action Summit 2015. A short detour to sign on the board and a short message, part of the pledge to work together with the world to bring down, or rather end, preventable mortality of mothers and children. Pin drop silence here for the moment, but the excitement is palpable because this is the kind of summit which will go a long way in creating new policies, in creating new strategies in terms of health for women and children all over the world. About 45 different practices are being followed in the world to end preventable child and mother deaths. The Prime Minister arrives on the dais. To a standing ovation. And we hand you over to the dais.
Namaskar to all of you, ladies and gentlemen, and welcome to the inaugural session of the Call to Action Summit 2015. Ladies and gentlemen, this two-day summit is a very committed and a dedicated resolve of 24 countries of the world to come together on one platform to discuss how to end preventable child and maternal deaths. And towards that, ladies and gentlemen, the presence of our Honorable Prime Minister, who is a globally recognized leader, in this very important session, which is actually going to be setting the tone and extending the direction for our discussions in the coming session, further accentuates the committed will and the dedication of the Government of India and its committed leadership. So we first thank the Honorable Prime Minister for his leadership to the summit. And now, ladies and gentlemen, in our true Indian tradition, in our customs and in our beliefs, we commence these discussions and deliberations by lighting the ceremonial lamp. May I request the Honorable Prime Minister, Shri Narendra Modi, to please light the ceremonial lamp, marking the auspicious beginning of the Call to Action Summit 2015. Ladies and gentlemen, while lighting the ceremonial lamp, we mark the auspiciousness of this summit, seeking the blessings of the Almighty. May also request the health ministers to please join in the auspicious act. thank you to the Honorable Prime Minister and other distinguished dignitaries. So, ladies and gentlemen, with the blessings of the Almighty and everyone present here, we commence now our discussions at the auspicious beginning of the Call to Action Summit 2015. May I now invite respected Secretary, Ministry of Health and Family Welfare, Government of India, Shri Bhanu Pratap Sharma, for his welcome address.
Honorable Prime Minister of India, Honorable Minister of Health and Family Welfare, respected Cabinet Ministers, Ministers of States, Excellencies, Ministers of participating countries, Heads of Development Partners, and co-hosts for the summit, esteemed delegates and members of the media. On behalf of the Ministry of Health and Family Welfare, it's my privilege to extend heartiest welcome to all of you to this very important Global Leadership Summit. Honorable Prime Minister, sir, we are indeed honored and privileged to have you with us, at this meeting, and we really express our gratitude for having consented to guide us as we embark on 2 days of deliberations. I'm sure your leadership, vision, insight, and knowledge will provide dynamism to our activities. I also warmly welcome Union Minister for Health and Family Welfare, Shri Narendra, who has led from front on all our activities. India is proud to host this Global Call to Action Summit. The maternal and child health has been at the cornerstone of all our health policies. In 1992, we had this program CSMM, which covered the entire gamut of the child and maternal health. Later on, this got subsumed into RCH and subsequently to National Rural Health Mission, which is a program which encompasses all the sectors which impinge on the health. Then we have added the adolescent health to this program. So now we have an entire life cycle approach which covers pregnant mothers, the new mothers, the newborns, neonates, the children and adolescent. And we face a lot of problems. India is a huge country with a huge population, so many diversities, so many disparities among the states in terms of manpower, in terms of income. But nevertheless, India has, because of the commitment, India has progressed very well in terms of the child and maternal mortality. Our maternal mortality, which stood at 540 in 1990, as compared to the global average of 380, is now down to 167. And we are very much in line to achieve the MDG 5. Similarly, the infant mortality rate, which stood at 126 in 1990 against a global average of 90, now is down to 49 against a global average of 46, which shows that the decline in the both the maternal mortality and infant mortality has been much faster as compared to the other countries. And there's no reason why we should not be able to achieve the MDG 5. It is because it reflects a very strong political will, sound strategies, focused policies, rigorous implementation framework, sturdy structures of monitoring and evaluation, and focus on health systems strengthening for effective health outcome. Excellencies and esteemed delegates, this 2-day leadership summit with the presence of some of the most eminent personalities in the field would certainly spur the activities. And there's so much of, there's a wealth of wisdom in this room. And I'm sure the discussions which would be taking place over the next 2 years will certainly impart, a lot of dynamism to the activity. So I once again extend a very, very hearty welcome to all the distinguished participants in the meeting, and I hope that you will have a very pleasant stay in Delhi. Thank you very much.
Thank you, sir, for your insights into the progress which has been made by India towards combating the child and maternal deaths. And now, ladies and gentlemen, we extend you reflections on leadership matters. I would like to invite our speaker, the Acting Administrator of USAID, Mr. Alfonso E. Lenhardt.
Well, thank you very much, and good morning to everyone. I want to thank Prime Minister Modi and the government of India, the government of Ethiopia, UNICEF, the Bill and Melinda Gates Foundation, Tata Trust, and the World Health Organization for hosting this important summit. It is incredibly powerful to see so many of you here to stand up for children and women around the world. You contribute your time and your resources. You think new ideas and develop cutting-edge innovations. And you lend your voices, all for the purpose of saving the lives of society's most vulnerable people. And you do it every single day. So I take this opportunity to thank you. Thank you all for all that you do and all that you will continue to do, because we are not done yet. Today, we face a situation considerably less bleak than it was in 1990, when more than 12 million children under the age of 5 died every year because of preventable conditions and diseases. But still today, far too many children, 6.3 million each year, are being robbed of the chance to lead full and healthy lives. They are being robbed by illnesses we can prevent and by infections we can treat. And far too many mothers, nearly 300,000, won't get to hold their newborns in their arms. Ripped from the world in the prime of life, these women won't have the chance to raise their families or contribute to their communities and to their countries. When a child dies and when a mother dies giving birth, it is a tragedy for all of us, because we miss out on everything they might have offered, and because it continues the vicious cycle of extreme poverty that holds the entire world back. Together, we can break that cycle. We can make sure every child lives to see beyond his or her 5th birthday, and that every woman can give birth without putting herself at extreme risk. And we can do it within a generation. This will not be easy. It will require major investments in health, not just from donor nations and global institutions, but from each country's own domestic resources. We will also need to employ new technologies and scale up proven and simple interventions. For example, treatments such as oral rehydration salts and zinc for diarrhea are available at a low cost and can save hundreds of thousands of lives. Perhaps most of all, ending preventable child and maternal death will require leadership and collaboration. We need civil society, the private sector, and governments to work together through Every Woman, Every Child, and other such partnerships. We need country ownership, concrete commitments, and results-oriented action plans. Our partners across the globe are already demonstrating this kind of leadership. For example, Ethiopia overcame a shortage of healthcare workers and the challenges of a rural landscape to cut child mortality by 2/3, and they did it 2 years ahead of schedule. And India has shown impressive leadership, setting ambitious goals and moving resources to support low-cost, high-impact interventions that have eliminated polio and neonatal tetanus. Countries all over the world are leading in this way, and it is how we will achieve our goals. When we work together to scale what works and focus on the poorest of the poor, we can indeed save lives. And we can make the world a better place, one where mothers and children everywhere can truly reach their full potential. I thank you for your kind attention. The United States Agency for International Development is honored to partner with you on this most noble work. Thank you.
Thank you, sir, for citing the importance of innovations, partnerships, and country ownership towards combating this challenge. And now, ladies and gentlemen, we bring you the perspective on what will be the drivers towards ending preventable child and maternal deaths. I would like to invite our esteemed speaker, Dr. Geeta Rao Gupta, Deputy Executive Director, UNICEF.
Honorable Prime Minister of India, Mr. Narendra Modi, Honorable Ministers of Health of India and of Ethiopia, and the many other Ministers of Health here with us today, other distinguished representatives of the Government of India and our partner governments, fellow co-hosts, colleagues, ladies and gentlemen. It's truly a pleasure and an honor to be here for this momentous occasion. There is tremendous energy in this room generated by all of you, your progress, your passion, your drive. So it's a pleasure to be here to celebrate our collective achievements and chart the next phase of the call to action, A Promise Renewed. Strong and healthy lives begin when we safeguard a mother during pregnancy and as she gives birth, when we protect an infant in the first days and months of her life, and when we give a young girl or boy all that they need through childhood and adolescence. Since 2012, when we launched A Promise Renewed, 178 countries pledged to do all of that and more. And so many of you turned those promises into practical action and made enormous progress. Let us take the example of our gracious host, India. India has made major strides since the Millennium Development Goals were launched. 8 out of 10 women now deliver in hospitals. There has been a 20% reduction in neonatal mortality in the last 5 years. One of the largest community-based health worker programs in the world now exists in India, with nearly 1 million ASHA workers reaching women and children where they live. And the biggest accomplishment of all, a polio-free India. That momentum is being further energized through the leadership and personal commitment of Prime Minister Modi through Mission Indradhanush, a program that aims to reach 9 million children who are partially immunized with a package of life-saving interventions, with Swachh Bharat Abhiyan, a program with the goal of a clean India by October 2019, and the launching of one of the largest real-time monitoring systems in the world to track the care of newborns who are at risk of losing their lives. UNICEF is proud to be a partner to the Government of India as it continues on this incredible journey to save the lives of the most disadvantaged women and children and to give them all a chance to thrive. Many other countries represented in this room have made similar promising progress. That is a great start. But there's so much more to do before we reach all women, infants, and children with life-saving care and give adolescents the opportunities they need to thrive and transition safely into adulthood. And I'm confident that we can, because many of you have proved that what we started together in 2012 with the renewal of a promise and a call to action works. Strengthening political commitment around this issue, building accountability, and mobilizing communities works. That belief is shared by the UN Secretary General, who has adopted many of these key ingredients into his new global strategy for women's, children's, and adolescents' health. Ingredients that will help us drive progress toward the Sustainable Development Goals. So to embrace the challenge of the post-2015 world and deliver better care to mothers, newborns, children, and adolescents, we must scale up what works. That includes targeting the hardest to reach, whether they're in rural areas or indigenous communities, urban slums, or even conflict zones. It includes looking beyond health at innovative ways to work across sectors at the community level with the community. Because nutrition, education, water, hygiene, sanitation, and protection all have a huge impact on the health of mothers, newborns, children, and adolescents. Especially girls' education, which not only empowers girls but increases the chances that their own children will be more healthy and educated than they themselves were. Finally, we know that these efforts can only be sustained by mobilizing communities around the survival and well-being of women, children, and adolescents. I'm talking here about a social movement which brings together governments, civil society, the private sector, and UN agencies. Imagine how influential these voices could be in demanding better services for all, in holding each other accountable against specified targets and goals. What a powerful tool of change that could be. Each of you, in your different capacities and in your different countries, has begun that process of change. So let's harness the energy here today and drive forward the new agenda for all mothers and their newborns, for all children and adolescents. Give them all a chance to survive and to thrive, and to give the world a new story to tell in 2030 as we celebrate the close of the Sustainable Development Goals. Thank you.
Thank you, ma'am, for your insights and the possible solutions which can help in addressing the challenge. And ladies and gentlemen, the world now enters a new era of global development with the Sustainable Development Goals. So how will these Sustainable Development Goals lead the change and transform lives? We now invite the views of Mr. Mark Suzman, the President of the Global Policy, Advocacy and Country Programs, Bill and Melinda Gates Foundation.
Honorable Prime Minister, Honorable Ministers, Excellencies, Delegates, as we have already heard, our co-hosts today, India and Ethiopia, are excellent role models of the progress that has been made during the era of the Millennium Development Goals. Many of the other countries represented here today, including Bangladesh, Malawi, Liberia, Tanzania, have all met the child mortality goal of reducing deaths by 2/3 or more by 2015 already. Many more are close to reaching the maternal mortality goal of reductions of 3/4 by the end of 2015. I was privileged enough to work at the United Nations at the time the Millennium Development Goals were launched in 2000. At the time, the setting of these targets was greeted with significant skepticism. It was deemed very unlikely we'd be able to make progress at the rate that we have and that we are celebrating here today. We believe at the Bill and Melinda Gates Foundation that the MDGs, and particularly the focus that they put on child and maternal mortality, have been one of the most successful things the United Nations has ever done, by being able to mobilize resources, bring together actors and stakeholders around common goals and common action. In short, the MDGs gave countries a roadmap for turning commitments into results. And the recent acceleration in the rates of progress we've seen in India and many other countries over the last 5 years can in part be attributed to the extra energy brought by both the Every Woman, Every Child initiative launched by the Secretary General of the United Nations in 2010, that most of the countries here are participants in, and the Call to Action Summit that was first launched in 2012. These efforts helped us understand how we need to work across the spectrum of reproductive, maternal, and child health to achieve results and accelerate progress. Now, as both the Millennium Development Goals and the original Every Woman, Every Child commitments expire at the end of this year, a new set of Sustainable Development Goals are being agreed. These will contain bold and clear new targets for maternal mortality and child mortality with a new deadline of 2030. aiming to largely end preventable deaths for both women and children. Similarly, we'll be launching a new Every Woman, Every Child strategy, Global Strategy 2.0, that will also focus on adolescence and nutrition. Both will be endorsed next month at the UN General Assembly. This will be the start of a major new effort to ensure that nearly every single child and every single mother in every single country has access to the basic health, nutrition, and education they need to not only survive and thrive. In this bold and visionary effort and agenda, the Bill and Melinda Gates Foundation is very proud to be a partner. Thank you.
Thank you, sir, for introducing us to the target which we have set forth with the Sustainable Development Goals. And now, ladies and gentlemen, we invite the views on philanthropy and innovations in the future, inviting our esteemed speaker, Mr. Krishna Kumar, the trustee of the Tata Trust, India.
Honorable Prime Minister of India, Shri Narendra Modi, Honorable Ministers, distinguished ladies and gentlemen. This Call to Action Summit could well be a transformational initiative to effectively deal with infant and child mortality and poor maternal health, a three-cornered, compounded problem which I shall call the triangle of evil, which is still a major threat to developing countries. You are aware that although India has achieved much, there is work still to be completed. We all know that the triangle of evil that I refer to, if not fully contained, can corrode the very essence of freedom. In our view, political freedom without robust economic well-being of the people cannot represent freedom for a nation in its truest sense. We welcome the summit, which not only lead to sharing best practices amongst countries and organizations, but also galvanize highly focused and sustained action. This is a formidable challenge, not only for governments, but civil society as a whole, and indeed responsible corporate organizations and individuals. This calls for an overarching partnership, a new social contract that attacks the problem at its very root. I speak on behalf of the Tata Trust, which was established by Jamshedji Tata and his two sons more than 120 years ago. The Tata Trust have been at the forefront of the battle against malnutrition and disease in India. The founders gave their personal wealth to establish the public charitable trusts, which have since gathered scale and force. You may wonder as to how the trusts are funded. The Tata Group, which has more than 100 companies at present, with an estimated value of over $112 billion, are held together at the apex by the parent company, Tata Sons Limited. Most of you may not know that 2/3 of the ownership of Tata Sons itself is held by the charitable trusts. So the dividend income from Tata Sons and from Tata companies does constitute the principal sources of revenue for the activities of the trusts. What the late J.R.D. Tata said resonates well with this truth. What came from the people has gone back to the people many times over. The ownership structure of Tata Sons has much to do with the strategic direction of the group itself, at the heart of which lies a firm set system of values and beliefs and a luminous vision with a deep commitment to nation building. The last 2 financial years alone, for example, the trust has spent more than 1,000 crores, a substantial part on health-related interventions across the length and breadth of our country. In the context of this summit, I reiterate that the vision of the trust is embedded in the renewed commitment to address this central challenge, which has translated into several programs touching the lives of millions of children, improving their health and building resistance to illness and reducing mental and physical deformities at birth. The trusts are conscious of the persistence of infant mortality, chiefly attributable to malnutrition and poor sanitation, equally applicable to poor maternal health. These problems have prodded the Trust to work on holistic programs based on the latest scientific inputs. Nutrition is linked to multiple aspects like availability of balanced diet, clean drinking water, and proper sanitation, all of which need not separate but integrated solutions. We are convinced that knowledge and technology are powerful tools that can be effectively deployed to deal with these challenges. To address the factors relating to stunting, wasting, and anemia among infants and children, the Trust have begun work on a number of initiatives in the high-burden districts of Maharashtra, Rajasthan, Uttar Pradesh, and Odisha, with an overall endeavor to improve maternal and child health in these regions. These initiatives are being developed, designed, and implemented in partnership with state governments, leading development agencies, and community organizations. Works in progress for fortification of staples in several regions of our country has commenced. We recognize that innovations in complex food products can happen only if we reach out for new ideas and new technologies. We also need strong central government support to overcome obstacles which we are sure under the leadership of Mr. Narendra Modi we will receive. We are therefore working with some of the world's best universities and establishments to use technology to good effect. For example, a path-breaking collaboration with the Massachusetts Institute of Technology, MIT of the US, is in place. Work is currently on to infuse micronutrients and other staples like rice, wheat, flour, milk, and edible oil. Currently, we are piloting some of these food staples with partnerships in midday meal programs deployed in several states in our country. The Trust will respond to the Call to Action Summit. We are aware that although India has made progress in this matter, the remaining work needs to be completed on a war footing, and the Trust offer their strong partnership to the government of Mr. Narendra Modi and to India, not only to fulfill the goals, but perhaps to surpass them. We believe that political freedom will always be incomplete unless poverty is banished. The true measure of progress in banishing poverty lies in ensuring a triumph over the triangular evil and turn the tide. We are firmly convinced that Gandhiji's vision of Purna Swaraj can only be achieved if poverty is banished, at the heart of which lies the compelling need to eliminate the tragic deaths of malnourished infants and young children for reasons that are entirely preventable. We believe that this is one compelling moral challenge that all of us should face with courage and determination. Thank you.
Thank you, sir, for your guiding views and your dedicated commitment to the Call to Action Summit 2015. And ladies and gentlemen, may I now invite Dr. Poonam Khetrapal Singh, the Director at the Regional Office for Southeast Asia WHO, for her views on developing an inclusive global agenda.
Honorable Prime Minister, Shri Narendra Modi, Honorable Ministers, Excellencies, distinguished participants. 15 years of the Millennium Development Goals have brought significant progress in reducing maternal and child mortality. Despite the achievements, the several countries will miss the targets of MDG 4 and 5. However, there is hope. As the MDGs are sunset, the Sustainable Development Goals will be launched next month by the UN Secretary General and other world leaders during the UN General Assembly on the 26th September in New York. This provides a clear mandate to build upon the gains of MDG 4 and 5 within the broader universal health coverage agenda. We cannot allow the gains of MDG era to be lost. We must build on the successes and use the experiences to strive towards greater achievements in the next 15 years. I would like to emphasize 4 points. First, we must be cognizant that more of the same will not do. This is the time to rethink. We have proven interventions to address maternal and child mortality issues. We know how to do it, but the interventions are either not taken to scale or are not reaching those that need it most. Therefore, we need innovative ways to deliver proven interventions to reduce equity gaps and enhance access to maternal and child health services. We need to take advantage of technology such as mobile technology and digital infrastructure to identify clients, monitor implementation, and track progress. We must look at integrated service delivery models that provide continuum of care across the life course. For example, why can't we deliver HIV, malaria, and TB drugs together with maternal and child care services, or vice versa? Second, there is no alternative to strong health systems in a country. A system that provides effective, safe, and quality healthcare services. Adequate health infrastructure placed strategically to match the spread of population locations with adequate health workforce to deliver a range of services and a logistics system that ensures regular supply of essential items are key to a well-functioning healthcare systems. Governments have a role and responsibility to ensure that the basic minimum requirements are in place for a resilient and sustainable health system. Understandably, not all governments may have the resources to do so. That is where the donor community and the international partners come in to support countries. Third, the problems of maternal and child mortality cannot be addressed by the health sector alone. Health is a contributor to economic development. Health is also a beneficiary of economic development. Good health contributes more than just well-being. There is interconnectedness between women and children's health to the broader socio-economic development agenda. Therefore, a conscious effort at integrated, well-coordinated, strategically targeted health interventions that engage civil society and other related sectors is critical for success to curb maternal and child deaths. The determinants of maternal and child deaths depend much or more on the actions or non-actions of other sectors that impact on health. Therefore, collective action and partnership across all sectors among development partners and in close tandem with the community are critical if we are to make notable gains in the years to come. And finally, the SDGs aim to eradicate poverty in all its forms and dimensions. This is important, as is good nutrition across the life course, access to food, improved sanitation, and clean water, which are basic needs to address the determinants of maternal ill health and child mortality. Excellencies, ladies and gentlemen, there is hope to do better, much better. A global financing facility has recently been established. This will no doubt greatly help those countries with the highest burden of maternal and child mortality. It is now widely acknowledged that national leadership, ownership, commitment, and accountability have been the key to success in the MDG phase of global development. I feel reassured to see an ongoing commitment to these principles in this summit with the presence of the Honorable Prime Minister of India and several ministers of health from our region and beyond. At WHO, we remain committed to collaborate with member states and partners so that our joint efforts provide sustained support for result-oriented national action with the full engagement of stakeholders and the community. Let us work together towards that end. Thank you.
Thank you, ma'am, for your suggestions and recommendations and for your commitment. And may I now take the privilege and the honor of inviting the distinguished Honorable Health Minister of Ethiopia, Dr. Kesetebirhan Admasu, for his address.
Thank you very much. Honorable Prime Minister of India, honorable ministers, distinguished guests, ladies and gentlemen. It is an honor and a privilege for me to be here today as a co-host celebrating the 3rd anniversary of Call to Action Promise Renewed at the juncture of the end of an era of MDGs and the beginning of SDGs. Over the last 15 years, Ethiopia has made spectacular improvements in terms of child survival and overall health of its people. This was possible through the prevailing peace and stability in the country, healthcare reforms with community empowerment and ownership through our flagship health extension program, sustained political commitment at all levels, innovative solutions to problems like task shifting, emphasis on building resilient health system by leveraging domestic and international support, and ensuring universal access to primary health care, providing key priority services and ensuring the worst off are not left behind. Distinguished guests, ladies and gentlemen, the government of Ethiopia is committed to end preventable maternal and child diseases within a generation. This will be possible through the unwavering political commitment, community ownership, and universal coverage of high-impact interventions. It is the responsibility of all of us to make our world safer for women and children. And we believe that maternal and child health and universal health coverage in general should be seen as a litmus test of good governance. To consolidate the gains that were made during the MDGs and accelerate the progress towards the bold and ambitious goal of ending preventable maternal and child diseases, the government of Ethiopia has developed a 20-year vision and a 5-year detailed health sector transformation plan. The plan has set out ambitious goals to be achieved in this period. I would like to state 4 of the transformational agendas we have highlighted in our health sector transformation plan. The first one is achieving high coverage, equity, and quality of health care. Equity and quality in particular are the core goals of the health sector transformation plan, which aspires to build a high-performing health system. Ethiopia has, over the years, demonstrated remarkable progress in expanding access to health care that resulted in dramatic improvements in critical health indicators. The gains have been as a result of improvements in health status amongst the disadvantaged groups, particularly those living in rural areas. Despite this progress, substantial inequalities still exist in health outcomes based on differences in economic status, education, and place of residence and gender. It is important in countries like Ethiopia that have started from a very low base to be satisfied and be complacent when you hit a coverage of 80%, 90% of critical interventions. But it is important to ask the question, who are the 10%, who are the 20% that are left behind? And we have to have a health system that responds to this important question of reaching every woman, every child in every part of the country. Achieving equity and quality will not be easy and will not happen overnight. We understand that. But most important of all, it will require a movement. And this movement requires a strong and able leadership at all levels of the system, robust participation and support of the community to ensure equity and quality of health care. In Ethiopia, essential health service is a constitutional right. But if you go to many parts of rural Ethiopia, people don't consider it as their entitlement. When they get the service, they consider it as a privilege. So we have to create a movement that empowers communities, that they are entitled to hold the government, to hold the health facilities accountable to deliver health services. So we will launch during this health sector transformation plan period what we call a health literacy movement, informing people, citizens, to demand services from health facilities and local governments. The second transformation agenda we have is what we call Warada transformation or district transformation. Ethiopia is a federal government with extreme decentralization to the district level. So we really want to transform our districts so that they are able to achieve high coverage of services, equity, and quality. And in the Warada transformation or district transformation, we have identified 3 pillars. The first pillar is creation of what we call model village or model kabalis. Our health extension program, the flagship program, has been implemented over the last 10 years. And the core success indicator of the health extension program was the graduation of model families, meaning families that get their children vaccinated, that have latrines, that goes, when there is a pregnant woman that goes to, to the clinics for antenatal follow-ups, that give birth in health facilities. These are model families that have demonstrated behavior change, that have improved the uptake of critical services. And we want to take in the next 5 years to the next level of moving beyond having model families to having model village, where we have open defecation-free village, home delivery-free village, and village where, critical school-based health interventions are taken to scale. So we will focus on creating model village through social movements, through the network of volunteers we have created with the support of our health extension workers. The second pillar of the district transformation is universal health coverage with robust financial protection. And we have been piloting what we call community-based health insurance in 200 districts. And in the next 5 years, we will take it to all districts, 875 districts in the country, with 100% coverage. And this will also ensure that people improve their uptake of the services. The third will be to have a high-performing primary health care unit. So the districts to have the capacity to look at the performance of our primary health care units, and for us to monitor the performance of the PHCUs using key performance indicators, and to have a mechanism to turn around those low-performing primary health care units. So with these 3 important pillars, we hope that we will achieve our district transformation agenda. The third transformation agenda in our health sector transformation plan is what we call information revolution. If you go to any facility across the world, a lot of data is collected, but few is analyzed and used to make decisions, particularly at the local level. Thousands of data sets are collected, but only few are required to be reported to national level. And those are the indicators that are most often analyzed. But there is a lot of data that can be used to improve the planning, to improve programming at the local level. And we will have the capacity, we will build the capacity in all health facilities, in all our districts and regional states, to do proper analysis of data and use it for decision making. And we will also digitize the 18 million family folders we have rolled out throughout the country, and to look at what is happening on the real-time basis at the community level. And we'll also have data integration using different sources. The last transformation agenda is developing human resource, developing the health workforce which is caring, respectful, and compassionate. And we will work very hard with our health and education ministry together to revise the curriculum, to make sure that we scale up the enrollment capacity of our health science college, and to guide and motivate and commit our health workers to end preventable maternal and child health and all the other ambitious goals we have set for ourselves. So these transformation agendas are interrelated with each other and anchored on building a strong and resilient health system. In turn, a strong and resilient health system is the very foundation, whether it is for improving maternal and child health, disease prevention and control, or effective management of public health emergencies. Distinguished participants, ladies and gentlemen, last month, Ethiopia hosted the Financing for Development meeting in Addis Ababa. And during the sidelines of that meeting, we have launched what we call the Sakota Declaration, which sets out ambitious goal of ending child undernutrition in a generation by 2030. Sakota is a place that used to be the epicenter of the famine in Ethiopia in the 80s. And many people have now in Ethiopia zero tolerance for famine. And we don't want it to happen. And we have been building a system for responding to these drought and emergencies. But we don't have zero tolerance for chronic undernutrition. That is why we named it after Sakota, to remind people that we have to end undernutrition as well. And nutrition is also important in ending preventable maternal and child diseases. So with the effective implementation of the health sector transformation plan, we are looking at reducing maternal and under 5 mortality by half in the next 5 years. And for this to come true, we count on strong government leadership and political commitment, robust community ownership, and the strong and continued international partnerships. In closing, I call upon all of us here to join hands to make the world a better place for mothers and children, and work together and share knowledge and experiences that will enable us to end preventable maternal and child diseases within a generation. We can and we must translate mothers and children's rights to realities. I wish you fruitful discussions and deliberations. Thank you very much.
Thank you, sir, for sharing the initiatives and the mission which you have outlined for yourself, for the government of Ethiopia towards addressing the challenge. And now, ladies and gentlemen, we have the address of the Honorable Union Minister of Health and Family Welfare, Government of India, Shri J.P. Nadda, who also has the distinct honor of being the President of the World Health Assembly in 2015. And his address is going to be followed by a signature film which captures the key milestones in India's efforts to end preventable child and maternal deaths. The address of the Honorable Minister.
Honorable Prime Minister of India, Shri Narendra Modi ji, health ministers from participating countries, ministers from various states of India, distinguished delegates. On behalf of my government, it gives me immense pleasure to welcome you all to New Delhi and to India. I hope you will have a pleasant stay and a very fruitful deliberations. It is fitting that the Global Call to Action Summit should be hosted by India. We have an impressive list of achievements to share and good practices that other countries may learn from. In turn, we hope that some of the successes of other countries that we will hear from during the next 2 days will help us to move towards sustainable development goals and move towards a healthier India. We are also here to forge a partnership between ourselves to renew the pledge to end preventable maternal and child death. All of us are indeed privileged to have among ourselves the Honorable Prime Minister of India, whose vision is to see a healthy world and healthy India. Health issues have been very dear to his heart, now as a Prime Minister and earlier as the Chief Minister of Gujarat State. He has given us valued guidance and provided exemplary leadership on all health issues and more so on issues relating to women and children. Today, when we all of us have assembled for Global Call to Action Summit 2015, ending preventable child and maternal deaths, I am happy to inform that as Chief Minister of Gujarat, he implemented an innovative initiative of e-Mamta using information and communication technology to ensure delivery of healthcare services to every pregnant woman and child. This has been scaled up nationally as Mother and Child Tracking System, MCTS. As a champion of convergence, he has set an example by launching the Beti Bachao and Beti Padhao movement. The Prime Minister's national campaign on cleanliness and hygiene, Swachh Bharat Abhiyan, has a direct bearing on overall health and well-being. We have a young population, we must make them healthy. We look at you, sir, to provide leadership not only to India, but to the globe on maternal and child health issues. It is indeed a landmark occasion when health ministers from priority countries join state health ministers of India and meet international academic experts, practitioners of global leaders from the corporate sector, civil society, development partners, and the media, and showcase the power of new partnerships globally as well as locally, deliberate on the methods to accelerate innovations and strengthen health systems delivery through a mutual learning process. I'm sure this is going to enrich the resources of knowledge of each of the country present here. While we celebrate successes, let us not only recollect the long road traveled, but also join forces to ensure healthy lives for mothers and children. While under-5 deaths are increasingly concentrated to sub-Saharan Africa and South Asia, the share of the rest of the world has dropped from 32% in 1990 to 18% in 2011. I'm glad to report that substantial progress has been made in reducing under-5 mortality rates, not only in India, but in other countries. India is happy to report that our maternal and infant mortality reduction in the recent past has been better and sharper compared to the global averages. But what about the 19,000 children who die every day globally from preventable diseases and never live to see their 5th birthday? This August gathering is aware that while India has overcome polio, reduced maternal and child mortality, increased vaccination, intensified its mission Indradhanush, yet disease like diarrhea and pneumonia still remain challenges. Our ministry has launched intensive campaigns for diseases like malaria and tuberculosis and HIV/AIDS to raise awareness and provide health care for infants, children, and vulnerable populations. I'm sure that there will be a lot of learning from other countries about ways in which these challenges can be addressed. Providing nutrition and addressing anemia are other priority areas for women and children, and our government is accelerating all efforts to see to it that we fight this disease and we fight this challenge and make it a success. While we are making all efforts, we must make sure that we walk the extra mile to reach the unreached. This is our priority area. The underprivileged and the hard to reach deserve the first attention. Equity must be the core of our thinking. Countries with higher burden of maternal and child mortality will need to make an extra effort. Today is an ideal setting where we will learn from each other and embark on new pathways to reach the underserved. India has already started the process by shortlisting 184 districts which need a concerted effort. It is time also to build on achievements and strengths, take advantage to ensure that new vaccines and improved healthcare practices reach the last mile to the disadvantaged, to those who lack access to service, by using technology and trained health workers. A promise renewed requires sustained multiple sector action to improve health of the world's children. Various fora in this summit, like the marketplace and the panel presentations, will focus on each one of these areas, providing opportunities for countries to discuss challenges and pathways to transformative change. Some of the good practices in the area of RMNCH&A and participating countries will find a place in the marketplace that showcase best practices is a platform for sharing and learning. I hope you will visit the marketplace that has been inaugurated by Honorable Prime Minister and get a chance to view demonstration of effectiveness of theme entitled for systems, partnership, innovations, convergence, and evidence. I am sure under the leadership of Honorable Prime Minister, we are committed to the cause of maternal and child health. We will not only be able to move towards sustainable development goals, but also aspire for a better world for mothers and children. I take this opportunity to welcome my ministerial colleagues to the ministerial conclave, which will discuss the leadership agenda for change and help and define concrete terms the transformation that we will like to see in terms of maternal and child health outcomes for every woman and every child to survive and thrive is the best possible way. I also welcome my colleagues, health ministers, and officials and ministries and of various states. Distinguished delegates, I welcome you once again and I wish our deliberations every success. Thank you.
Welcome to India. But this is not the India you've known. This is another India. An India that decides and does. Welcome to the new and vibrant India, where women are our pillars of strength. Children are our hope. We made a pledge along with all of you to protect and nurture them. Today, we have achieved an environment where mothers and children have a chance to thrive and prosper. Given our population, diversity, geographic versatility, and culture, we have developed programs that work for us. Our commitment to progress in Millennium Development Goals is best reflected in a higher decline than the global average in under 5 mortality rate and maternal mortality ratio. Prior to 2005, less than half the pregnant women in India went to an institution for childbirth. Today, almost 80% of childbirths are institutional, and we are not far away from the day where almost all childbirths will be institutional. This is because of facilities like improved transport systems to bring pregnant women to health facilities and schemes that have ensured institutional accessibility to every mother and infant. On 27th March 2014, India was officially declared polio-free. Today, maternal and neonatal tetanus have also been eliminated. ASHA, or Accredited Social Health Activist, has been a game changer in the maternal and child health program in India. Nearly 1 million community-level women now reach almost every part of India. Sparked by the visionary leadership of our Honorable Prime Minister, we are striding ahead to better our best. As a next step, Mission Indradhanush is targeted at hard-to-reach communities. In the next 5 years, we hope to provide full immunization cover to every child in India. The India Newborn Action Plan was launched in September 2014 to end all preventable newborn deaths and stillbirths. Kayakalp, a recent program, has been introduced to keep hospitals clean and safe. As a part of our nation's strategic integrated approach, a number of schemes have been launched at the national level that are all interlinked to build a healthy, progressive India that reaches its rightful potential in the global community. Our milestones in health have been significant because we believe a healthy mother and child mean a progressive, developed nation. Join us and our partners to create an India that smiles with health and happiness.
So, ladies and gentlemen, that's the new, vibrant and transforming India under the leadership of our Honorable Prime Minister. And on this occasion, we now have the release of a coffee table book. May I request the Honorable Prime Minister to please release the book. This coffee table book, entitled Born to Be, captures the unprecedented journey of maternal and child health in India in the last 25 years. The book draws its inspiration from a Sanskrit phrase, Tat Tvam Asi, that is, thou art that, meaning all life forms can be identified with the original source. And this book recounts the progress made in reductions in child and maternal mortality from 1990 to 2015 and is a tribute to the dedication of all the frontline workers. And may I now request the Honorable Prime Minister to kindly release the report, Acting on the Call. In 2014, USAID unveiled an action plan titled Acting on the Call, outlining how it plans to support the 24 priority countries. And ladies and gentlemen, as we emphasize on the role of leadership towards combating this daunting challenge, in Prime Minister Modi, we have an extremely dynamic and a very sensitive leader who's believed in gender equality, and therefore he's always emphasized on the adequacy of good health care and good nutrition for women and children. And I think all present here will agree that a true leader must have a compelling vision to lead, to steer people forward, and to help. And our Prime Minister Modi embodies both this vision and drive, inspiring people, inspiring nations, inspiring the world with his plans. So please join me, ladies and gentlemen, in inviting our Honorable Prime Minister, Prime Minister Modi.
My colleague, Shri J.P. Nadda, Minister of Health and Family Welfare, Government of India, Shri Admasu, Minister of Health, Government of Ethiopia, Honorable Minister from participating countries, representatives of development partners, friends from civil society, private sector, media, academia, national and international speakers, and the esteemed delegates. On behalf of my government and all the co-hosts for this international summit, I warmly welcome you to the Global Call to Action Summit 2015. This is a landmark occasion, and for the first time, the Global Call to Action Summit is being held outside USA. My government is honored to host this summit. All those delegates who have traveled a long distance to attend this summit, I heartily welcome you to India and to New Delhi. I'm delighted
to be with you this morning. This two-day summit celebrating the achievements of the participating countries in the area of maternal and child health was conceptualized to accelerate joint leadership for ending preventable deaths among mothers and children. It will showcase the power of new partnerships, innovations, and systems to bring about improvements in life-saving interventions. I firmly believe that this summit will provide a highly effective platform to address common challenges that will help us achieve the desired goals. How we shape the world in the next 15 years will make the difference between prosperous, optimistic nations and insecurity and unrest. I'm glad to see 24 nations present here to join together in their commitment to end preventable maternal and child death. This is a call to action to all of us to seize this opportunity and think big. Today, as we gather here to discuss strategies and as we transit from Millennium Development Goals to Sustainable Development Goals, let us acknowledge the sad reality that the world continues to lose about 289,000 mothers and 6.3 million under 5 children every year. The 24 priority countries participating in this summit contribute nearly 70% of the preventable maternal and child deaths. For India, with a birth cohort of 26 million, the challenges are formidable, but the commitment to succeed is also as strong. But however does offer hope is that most of these deaths can be prevented through simple yet effective and proven intervention. This forms the key peg for this summit. This also forms a crucial part of the joint statement issued subsequent to the visit of the US President in January this year, where we agreed to further accelerate the joint leadership to end all preventable maternal and child deaths. Keeping aside the work that still needs to be done, there have been significant achievements on the global front in the areas of maternal and child death. Looking at the big picture, we find that in 1990, India's under 5 mortality rate stood at 126, while the global average was only 90. In 2013, this figure dropped of 49 against a global average 46. Therefore, the gap of the global average reduced from 36 points in 1990 to just 3 points in 2013, reflecting that India has achieved under 5 mortality rate decline at an accelerated pace compared to global rate of decline. What this translates into is this: India is like to reach close to achieving the MDG target if the current trend of annual decline is sustained. In addition to this remarkable achievements, another truly historic accomplishment has been the victory power over polio. India was declared as polio-free on 27 March 2014. From being a country which accounted for more than half of the global polio cases in 2009, to being declared free of the wild polio virus, the journey reflects India's deep commitment to child health. I am also happy to share with you today another major milestone achieved by India. India has eliminated maternal and neonatal tetanus. The validation for this has happened much before the global target date of December 2015. This gives us the confidence to achieve other targets well before the target date. The efforts of being polio-free and maternal and neonatal tetanus-free nation and to accelerate the full immunization coverage in the country, my government has added to the world's largest immunization drive another mission known as Mission Indradhanush. It focuses on vaccinating the left outs. It also targets to accelerate the current increase in annual rate of immunization from existing 1% to more than 5% per year. This will help us achieve more than 90% coverage by 2020, which otherwise would take more than 25 years at the current pace. The first phase has been successfully implemented. We want to ensure that no child in India dies of vaccine-preventable disease. India has always partnered with the global efforts on issues of child and maternal health. India is the first country to respond to the global commitment to reduce newborn mortality subsequent to the launch of Global Every Newborn Action Plan, ENAP, at the World Health Assembly in June 2014. India launched the India Newborn Action Plan, INAP, in September 2014, targeting reduction in neonatal mortality rate and stillbirths to single digit by 2030. India also responded by acting on the first call to action through its commitment on launch of RMNCH plus A. This remarkable success in the field of maternal and child health have been possible through our National Health Mission. The mission, with its urban and rural health components, perhaps one of the largest public health programs in the world, has resulted in improved health outcomes. 52% of India's under 5 mortality is contributed by deaths of newborns in the first month of life. Under the NHM, our approach emphasizes a continuum of newborn care both at community and facility level. Our focus has been to get pregnant women to have a safe delivery in our institutions. We launched an ambitious program, Janani Suraksha Yojana, where incentives were given for delivering in public institutions to the beneficiaries directly. As a result, today, more than 75% of the deliveries take place in our institutions. This has directly contributed to reduction in maternal mortality. We are fully aware that out-of-pocket expenses remain a key barrier for women to access timely health care and services. To overcome this, we have launched a program called Janani, Shishu Suraksha Kalyan, under which every woman delivering in a public health institution as well as the newborn is entitled to free and cashless health service with an assured provision of free drugs, diagnostic and diet besides free to and fro transport. This has helped to further improve our institutional deliveries. Not only are the mothers provided focused health services, but individual beneficiary tracking is being done through the countrywide maternal and child health tracking system, which ensures close tracking of inputs and outputs at the level of service provision. More than 92 million mothers and 78 million children have already been registered so far in the system. One of the major concerns is equity. As a step towards ensuring equitable health services across regions that suffer from intra-state disparities and to bring about sharper improvements in health outcomes, a total of 184 poorest performing districts all over the country have been identified. Special efforts are being made to put in more resources and focus programs in these areas. One of the flagship programs of my government is the Swachh Bharat Abhiyan, the Clean India campaign. As a part of this large campaign, the Health Ministry had launched the Kaya Kalp scheme to encourage public health facilities to maintain high standards of hygiene and sanitation, as I firmly believe that clean and hygienic environment is the stepping stone to a healthy nation. To save and educate the girl child, we have launched an ambitious program, Beti Bachao, Beti Padhao. We need to ensure that the girl child survives, thrives, and plays a very crucial role in the society. I have witnessed people getting poorer because of unfortunate health episodes. We need to institutionalize a system where marginalized communities receive universal health care and financial protection. We must experiment and learn from each other. India stands ready to boost its commitment and partner with other countries and move forward on our promises to end maternal and child deaths and provide a better life to the adolescent. I invite you to commit to bold measures and hold each other accountable of these promises. As we assemble here, we need to send a very, very strong message not only to ourselves, not only to the 24 countries present here, but to the entire world. The message is our commitment that we will ensure that every woman, every child who can be saved will be saved. We also need to make a clarion call to the world to join hands in taking such steps that would ensure this. India stands committed to not only allocate resources toward this in our country, but also to help the world and all those countries which needed any support. It is my personal vision and my government's firm commitment. While every country present here has something to offer, India also has a wealth of experience. India has done well in many ways and would be extremely happy to share its experience with other countries. Last year, I had made a commitment of assisting the SAARC countries in keeping it polio-free. We have also made a commitment to provide pentavalent vaccines to such SAARC countries as would need it. We will offer whatever experience we have to the world community. India would be happy to assist any country with technology, system, strengthening, and program implementation capsules. We could train personnel and skill them for better management of child sickness in our special newborn care units, as well as share our experience at home-based newborn care, India's rich experience in universal immunization, and particularly its experience this year with the mission Indradhanush could be shared with all the countries. We had offered this to SAARC countries earlier. Today, I repeat this offer to all countries present here. This will be apart from our effort to support for polio eradication. I again warmly welcome you all to this important international summit. I hope the next 2 days would provide a new direction to the global community in its journey towards ending maternal and child death. I wish you a pleasant stay in New Delhi. Thank you very much. Jai Hind.
Thank you, Honorable Prime Minister, for sharing your very progressive vision and extending your leadership to the summit. So thank you once again, Honorable Prime Minister. And ladies and gentlemen, as we conclude the session, may I now invite Mr. C.K. Mishra, the Additional Secretary and the Mission Director, National Health Mission, Ministry of Health and Family Welfare, Government of India, to kindly propose a formal vote of thanks.
Honorable Prime Minister, Excellencies, distinguished dignitaries on the dais and in front in this hall, we have been consistently talking about commitments, goals, systems, strategies, and partnerships. They're all very valuable for our pledge to end preventable maternal and child death. But ladies and gentlemen, none of this will bear fruit if there is no strong political commitment and great leadership. It is our proud privilege this morning that this leadership is being provided by none other than our Honorable Prime Minister of India. We are grateful to you, sir, for your presence and your leadership, not only to India, but to the global community on maternal and child health. On behalf of all those present here, sir, and many who've just heard you, let me assure you that your call to end preventable maternal and child death will be translated into action. India in particular will no longer be known for the numbers it contributes to this, but will be counted for the strategies it implements to end this. We are privileged to have amongst us a Union Health Minister of India. Sir, your guidance has been our constant source of strength and inspiration. Thank you for being here and guiding us, sir. We also thank the Honorable Minister from Ethiopia. Thank you for partnering with us and your stewardship in the movement. We also thank the DG Health for his support, guidance, and technical guidance. Partnership has been the cornerstone of Indian turnaround. Our gratitude, ladies and gentlemen, to all our partners, USAID, UNICEF, BMGF, WHO, Tata Trust, and all others. We will together take the movement forward. This will not be possible without very active participation and supports from the states of India, and we are grateful to all the states who are present here today. We are grateful to the officials of Government of India and the state governments for being with us and adding value to whatever we do. Indeed, all these partnerships are valuable. But what is absolutely invaluable is the support of all of you, ladies and gentlemen, to this movement in the world. You are the driving force, and together we shall do it. Thank you very much for not just helping us with it, but actually being the movement. This message must spread. We are grateful to our friends from the media for carrying this message across the globe, because everybody needs to know what we need to do. We pledge today to make the globe a much safer place for all our mothers and children. They are born to be. Thank you, all of you who assisted us, helped us, all the officials and others in organizing this summit. Thank you very much, ladies and gentlemen.
Thank you, sir. And ladies and gentlemen, we once again thank the Honorable Prime Minister of India for showing us the direction, for guiding us. Thanking once again the Honorable Prime Minister.
The Call to Action Summit 2015 was inaugurated by the Honorable Prime Minister of India, Shri Narendra Modi. A renewed sense of determination to end preventable maternal and child mortality in the world. The Prime Minister leaves the venue, but deliberations will continue here over today and tomorrow. But for the moment, our team takes leave from Taj Palace.